perfusing adequately, you're probably going to show signs of cyanosis. Cyanosis is usually indicated by blue fingertips, blue lips, and can advance on into worse and worse. Your pulse ox reading is going to tell you how much oxygen, but if they're not perfusing adequately, then they're circling the drain very quickly. You're going to want to listen to some breath sounds. Just take a second, see what you hear. If you hear, some rails or something, that's going to be indicative of fluid in the lungs. That's probably something that's going to need to be fixed. But you have your upper airway and your lower airway. Okay, this is kind of your lower airway here. You have your trachea that comes down, turns into your bronchi. Now your bronchi stems off into both your lungs, your left lung and your right lung, okay? And down in your lungs you have the alveoli, which this is where your oxygen transfer comes from. When you inhale that oxygen into your lungs, the oxygen is going to go through your alveoli and into your bloodstream, which is going to carry that to your vital organs. Okay, so what are some of the causes of breathing problems? The most common breathing problems, especially in the EMS world, are going to be things like COPD, which is chronic obstructive pulmonary disease. You're going to have asthma, that's very common in children. You're going to have congestive heart failure, which is where you collect a lot of fluid. Your body's not able to disperse that fluid properly. And then you're going to have things like allergic reactions that cause, constrictions in your airways, which, you're going to be able to hear wheezes or something of that nature. And that's going to tell you, associated also with a rash or things of that nature. So here's a couple of your basic breath sounds that you're going to hear. You've got your rails, which is going to be kind of a fine crackle. It's often associated with the sound of Velcro being ripped apart. It's a very fine crackle. You've got your rhonchi, which is kind of a lower pitch, kind of a deeper snoring or rattling sound in your lower airways. And then you've got wheezing, which is a high-pitched whistling sound. Wheezing is generally when your airway is inflamed due to some sort of reaction by your body. Your airway is going to inflame itself and cause a narrowing of that airway, which is going to whistle, such as when you try to whistle yourself, you put your lips closer together and blow air through it, and that's how you make the whistling sound. So stridor is a high-pitched wheezing from the upper airway, usually on inspiration. This is a good indicator of an airway obstruction. Okay, this is a very bad sound to hear. So then there's croup. Croup is generally in pediatrics. It's going to be kind of a seal-like bark that once you hear it a few times, you'll know it by heart every time afterwards. So you got circulation. Circulation, of course, is your blood flow through your body. You're going to want to make sure they have good pulse. If they're breathing, then obviously they have a pulse, okay? But if they do have a pulse, they may or may not be breathing, so that's something to keep in mind. You're going to want to check both radial pulses, okay? Your radial pulses are going to be absent if their blood pressure is below 90 systolic. So if they have these radial pulses, they have at least a 90, which is a good number to remember for trauma later on. You're going to want to check and see if they're equal in strength, equal in rate, and if you're at such a level where you have them on the monitor that their radial pulses beat at the same time that it does on the monitor, which they'll go into that later on. Is it regular or is it irregular? There are people every day that live with an irregular heartbeat, such as AFib. AFib is a very commonly diagnosed irregular heartbeat that I'm sure thousands and thousands of people across America have. Strength and rate of pulse. So, like I said before, the strength of your radial pulses is a good indicator of your blood pressure. You're getting that blood out to your extremities. Another important thing to note is the rate. The rate of your pulse is going to indicate a lot of things. Can be signs of shock in trauma patients, can be signs of some sort of cardiovascular emergency in some medical patients, especially those experiencing chest pain or even things like weakness, diaphoresis, cyanosis. Those are some good indicators that either the heart or the lungs are not working properly. So another thing to note when you're looking at circulation is your skin color, okay? Do you have blue fingertips? Are you pale? You're going to check capillary refill, which is done by squeezing the end of the finger and counting the amount of time until it turns pink again. So the next major thing on the list is to check for bleeding, okay? So we're not talking about a little scratch on the arm, we're not talking about a little scratch on the cheek, or a little cut that's barely bleeding. We're looking for major bleeding, okay? You're going to see pooling blood, a large amount of blood in one spot. That's going to be a great indication of one of two things. Either A, that they are bleeding profusely from some place, or B, that they have been bleeding for a long period of time, which can be just as bad. Open fractures, you're going to want to look for open fractures, bones sticking out of their legs, bones sticking out of their arms or elsewhere. Another big thing when it comes to bleeding, you may not be bleeding on the outside. You may not see blood anywhere on them. But abdominal distension is a good sign that you're bleeding internally. Maybe in your abdomen, maybe that you have some sort of lacerated organ due to trauma and you're bleeding out on the inside, which can be just as bad as bleeding on the outside. Because when your blood is outside of your cardiovascular system, it's not being pumped to all your vital organs and it's not carrying that oxygen. So, like I said, some interior and exterior causes of blood loss, open fractures, large lacerations. The head generally bleeds when the skin is broken a lot more than other places on your body. Bleeding can lead to hypovolemic shock, which is low blood volume in your system. Okay, if the blood's elsewhere, then it's not being pumped by your body. So these are things that must be fixed as soon as you can. You don't want somebody to bleed out on you, and it may end up down the road that they need a blood transfusion to replace a lot of blood loss. So another good thing to keep in mind is you may or may not be able to find out is if they're on blood thinners, okay? Blood thinners or anticoagulants are going to cause you to bleed more. They're going to cause you to not be able to stop that bleeding as easily. You may have to use coagulating agents or a tourniquet even sometimes. So that's one thing to keep in mind. Okay, at the end of your primary assessment, you're going to want to make a transport determination if you haven't already. So the questions that you're going to want to ask yourself is the patient critical enough to warrant just loading them and trying to do your interventions on the road on the way to the hospital? Can you fix what's wrong with them on scene? Do they need surgical intervention? Another good thing to remember is a stroke. A positive stroke screen is an automatic immediate transport because there's nothing you can do for them on scene that's going to help them more than getting them to the hospital immediately so that they can take them into surgery and fix either an ischemic stroke or a bleeding stroke. So the golden hour rule is associated with strokes. You have an hour. You want to, within an hour of them starting to have a stroke, you want them to be in the hospital. So if they've put off calling EMS for 15, 20 minutes because they're thinking maybe these symptoms will just go away. Maybe it's just something else, 20 minutes or so, they wait. Finally, they call EMS. Say you have a 5-minute response time. There's 25 minutes. You're on scene for at least 5 or 10 minutes. that's 30 to 40 minutes, you know, so you've got very little time. You need to recognize that stroke as soon as possible and get on the road to the closest, the most appropriate facility. Here in Haywood County, you're not going to go to the Haywood County Hospital for a stroke. You're going to go to Mission. Mission is better equipped to deal with strokes. So also, you're going to keep in mind that your critical trauma patients need to be transported within 10 minutes as well. Okay. Your critical trauma patients, you can pump fluid into them, you can try to control the bleeding, but they're most of the time going to need some sort of surgical intervention. They're going to need bones reset, they're going to need pressure relieved in their head, they're going to need blood transfusions, they're going to need all these things that we can't offer them on an EMS truck or out in the field. So it's very important to keep in mind of how long you're staying on scene, especially on these two things. Okay, your secondary assessment. Your secondary assessment is done once you've determined whether you're going to transport immediately or not. Your secondary assessment is going to take a little more time. It's going to be a little more in depth. So what you're going to do is you're going to start from the head and you're going to work your way down. And you're going to look at and feel every part of their body from head to toe. You want to check the entire body for decap BTLS, which we're going to go over here in a minute, and you're going to want to know every single thing that's wrong with that patient, anything you can find, okay? And this is also the section where you're going to obtain a history and obtain your vital signs if you haven't already. Now, your critical patients, of course, during your ABCs, you're gonna try to get some vital signs in your ABCs on a critical patient, because there's not going to be a whole lot of time for this secondary assessment later on. You may be able to do a quick one in between interventions, or maybe if you have more help than just you and a driver, you're going to be able to get more done. But that's, this is the real world, and that doesn't always happen. So, it's important to look them over from head to toe, but you're really going to take time when you do a secondary assessment. You're going to feel everything. You're going to go over everything, because you don't want to show up at the hospital and have missed injuries that you could have fixed. So, like I said, you're gonna start at the head. You're gonna expose the entire body, and you're gonna palpate every part of the body and check for any injuries or anything that's wrong. So your decap BTLS is a good mnemonic to remember for deformities and discolorations. You're going to look and see if you see any bones sticking up toward the skin. You're going to find if anything's twisted, pointing in the wrong direction or such. Discolorations, could be as simple as bruises or redness or anything like that. Crepitus and contusions. Crepitus is when you move your joints, you're going to feel kind of a grinding where there may be some damage on the inside, where you're feeling kind of a bone-to-bone interaction there. Contusions can be sort of like bruises. It's going to be blood under the skin. Abrasions and avulsions. Abrasions are going to be, scrapes, that sort of thing. Avulsions, penetrations and punctures. Those are pretty self-explanatory. Burns, tenderness, lacerations, swelling, and symmetry. Okay, symmetry. You're going to want to know if their legs are the same length. You're going to want to know if their hips are crooked. One side sticking out further than the other. One shoulder sticking down further than the other. Everybody should be designed to be symmetrical. In some rare cases, some people are born otherwise, but in most people, they're going to be symmetrical all the way around. So, your sample history, it's a good thing to remember when you're doing medical calls. You're not always going to be able to obtain a sample history in trauma patients unless maybe there's a family member there with them or somebody that's conscious that can give you a little bit of insight. You're looking at their signs and symptoms. You're going to ask them, what's going on? Are you nauseous? Are you dizzy? How long has this been going on? What are you feeling? Why did you call me? Allergies. You're going to want to know what kind of allergies they have. whether they're allergic to latex, adhesive tape,